Awesome. All right, officially being recorded. Uh-oh, not kidding. Hello, everyone. My name is Molly Murch, and I am the stroke program educator at Essentia Health in Fargo. Thank you to Stephanie for reaching out to my colleague Ryan and I about coming and doing these presentations for you guys. Ryan and I love doing community education, not only for our critical access hospitals and EMS, but also just for members of the community. We want this session to be informational for you guys. We hope that you learned something that maybe you didn't know. We will do question and answer at the end. I have a presentation on stroke, and then I'll take questions, and then Ryan will do his presentation on heart and STEMI and answer questions. Ryan and I love to do these presentations together because, as you will see, our hearts and our heads are connected. So a lot of the stuff that I'm talking about, Ryan's going to also talk about as far as when we look at risk factors and that kind of thing. So here we go. So let's see if we can get my, okay, all right, there we go. My screen to sharing all this technology, guys. All right. Good. Everybody see it?
It looks good. It's not in like a PowerPoint mode. I don't know if you want that. It's just in slides right now.
Oh man. There we go. Better?
Yep, we're good.
Perfect.
All right. So yay, there's me. No conflicts of interest with this. My main role as the stroke program educator is to provide education. I'm very passionate about nursing and I'm passionate about education. So I love what I do. So, and I'm so excited to be here to talk with you guys. So we're going to talk about a few different things today. So here are our learning objectives. But what I want to open up with is there's a series called Stroke Through Their Eyes. There's two small videos, and actually it's the same video, but it's through, one of them is through the eyes of the witness, so somebody seeing someone having a stroke. And then the second video is the same exact scenario, but it's through the eyes of the patient having the stroke. So I am going to pull this up. And while we're watching this, for you out there, just imagine what it would feel like for you, and then also for somebody who's observing you having a stroke, what that would feel like. Let's see if this actually pulls up here. Hannah. Staying slow here today. Aha, there it comes. Wow, it's really slow today. Come on, thing, you can do it.
I guess while we're waiting,
oh, there we go.
There we go. Okay, sorry. No, I was just gonna say, who do we have on as learners here today? Do we have medical providers? Do we have people from the public? Do we have kind of a combination? Who's on?
If you guys want to take yourself off of mute or just throw it in the chat, anything would be helpful.
I'm Sherry, and I am from the public.
Welcome.
Thank you.
Well, the rest of you, we might find out who you are later on during our Q&A sessions. But yeah, like Stephanie said, oh, yep, I see a few people in the chat. So again, this little video I'm going to show you is stroke through the eyes of the patient. So somebody who is actively having a stroke. So try and pick up some of those signs and symptoms of a stroke, which we're going to talk about, but mostly just think about what if this was you or one of your loved ones, and how would this impact you. So here we go. Can you hear that?
We don't see or hear anything, just your PowerPoint still.
Oh,
You have to share the other screen again.
Ryan. All right. Oh, shoot, 1 second. I don't think I shared the sound with that one. All right, how about that?
You can
You
see
see
it.
All right, let's see if
That's
we can
better.
hear it.
He's been wanting to put garlic chives.
Can you hear it?
Yep.
Yay, all right, we're in business. Here we go.
Now he's been wanting to put garlic chives in everything.
Not everything.
Dad, side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I can't do
Dad! Jim! I need an ambulance to 7th floor.
Tim, look at me, Gracie.
Tell them to hurry.
Tim, look at me, Tim.
Dad, I think he's having a stroke. Sweetheart. My husband. I think he's cold. Are you cold, honey? Are you cold? Okay. Gracie? See, Gracie's gonna come, sweetheart. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? I'm right here. Gracie, meet us there. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Just breathe. Tim?
Dad?
How you feeling?
I'm fine.
Well, you've had a stroke. But because you got here quickly, you're looking at a full recovery.
So does anybody have any input they want to share about what they just saw in that video? Any feelings?
Seems scary to me. Chills. Someone put in the chat.
Oh, my thing is still going. Sorry. My videos are still playing. Oh, there we go. Like, why is it still playing? Any other feelings or impacts that you got from that video? So one thing we're going to talk about today is how suddenly strokes happen. So as you could see, it was the wife and the daughter and the husband. They were making dinner, and all of a sudden, boom, the symptoms hit. And as you can see, he had multiple symptoms at once, and they were progressing very quickly. Luckily, there's somebody that got to him quickly and got him to the hospital. And then you could see at the end, he could move his arm. He could talk again. So we're going to talk about some of that today. And if you have any other feelings or anything you want to put in the chat about that video, feel free. All right. So a raise of hands, or you can put in the chat box, how many of you personally know someone who's had a stroke? Most people do know somebody who has had a stroke. And so I do like to put some famous faces of people who have had strokes. You guys probably recognize quite a few of these people. I try and keep our local boy, Kirby Puckett. So those of you from Minnesota probably remember him back in the late 1990s, early 2000s. He was a phenomenal baseball player for the Minnesota Twins. And actually, unfortunately, at age 46, he died of a hemorrhagic stroke. Betty White, as you all know, died a couple years ago at age 99, but they did determine she had a stroke 6 days prior to her death. And then FDR, one of our former presidents, he was actually sitting for a presidential portrait when he complained of a sudden severe headache, slumped over in his chair, and that was it. Some more familiar faces: Loretta Lynn, Dick Clark, Charlie Daniels, Sharon Stone. Back in the when she was in her 40s, she had a stroke. A former linebacker for the New England Patriots, Teddy Bruschi, he was only in his 30s when he suffered a TIA and a stroke. Della Reese, Luke Perry was only 52 when he died of a massive ischemic stroke. Some of these people are still alive. Tim Curry and Randy Travis are both still alive. They suffered very debilitating strokes. Bill Paxton, 2 of the 3 Stooges. So Curly actually died in his 40s of a stroke, and Larry died at age 76. And then there's a reason why I put this gentleman on here. This gentleman's name is Michael Johnson. And back in the 90s, he was a phenomenal Olympic athlete for the US, won multiple gold medals, and at one time was known as the fastest man on earth. He actually suffered a stroke, which left him unable to walk for a period of time. So during my presentation, this is when I ask, when you look at these people, when you look at these famous people, what's common amongst them? And it's actually a trick question. There's nothing common among them. Yes, they're human. Yes, they all have a brain, but otherwise there's nothing common among these people. And that's the whole point with stroke, is that strokes can and do occur at any age. So for a long time, people had the mentality, and some people still have the mentality that, oh, I can't have a stroke. Strokes only happen to the elderly. I'm fine. I don't need to worry about having a stroke. Well, that's no longer true. Strokes can and do occur at any ages. And like Ryan will talk about later, we're seeing younger and younger people having strokes, and we'll talk about why. But as you can see, young, old, Black, white, Hispanic, healthy people, even an Olympic athlete, can have a stroke. So that's an important thing to remember.
There are 2 people in the chat that have had strokes.
Oh.
One at age 20 and one at age 43.
Oh, wow. Well, maybe here towards the end, or as we're going along, if you want to share your guys' story or kind of what happened with you, that would be great. So we talked, or we looked a little bit at some of those famous people that have had a stroke, but for you and I, what does it mean to have a stroke? So we need oxygen and blood flow in pretty much throughout our bodies, but the 2 big places we need oxygen and blood flow is our hearts and our heads, okay, our brains. So our hearts and our heads are connected, and we get oxygen and blood flow from our hearts. It gets pumped up through these 2 big arteries in our neck called our carotid arteries, and then it goes into the vascular supply in our brain. When someone has a stroke, there's an acute interruption of blood supply to an area of the brain. Now, whether that's due to a clot or whether that's due to a rupture of one of those arteries in the brain, either situation is not good. Again, we have that acute or sudden interruption in blood supply to our brain. And so now my brain is not getting what it needs, and it starts to die. And that's when people have signs and symptoms of a stroke. Okay, does that make sense, hopefully? So the big thing for everybody to remember is that stroke is a brain attack, okay, and is a medical emergency, meaning time is brain. Every minute that someone is going or is having a stroke, we're losing brain cells, okay? So just some statistics for you guys. Of course, we always have to tie in statistics. So as you will learn from Ryan as well, stroke and heart attack continues to be a major issue in the United States. Someone in the US has a stroke every 40 seconds. So pretty much once a minute, someone's having a stroke. I wish I could say that this second bullet point has gotten better, but it's actually gotten worse in the last few years. Every 3.5 minutes, someone dies of a stroke. It used to be every 4 minutes, but now we're sitting at every 3.5. I have a feeling that's a result of COVID, people not getting out and about, not being as active, not going to the doctors and getting their chronic medical conditions managed. Who knows? But I'm hoping that number gets better. The big thing for everybody to know is that 80% of all strokes are preventable. That's a huge number. There's not a lot of conditions out there that we can say, I can prevent myself from having a stroke 80% of the time. And by managing my risk factors, knowing what my risk factors are, okay? But of course, there's always that 20%. So super healthy person, no risk factors, no family history, and they have a stroke. Why does it happen? We don't know all the time. So we already talked about this, but stroke risk increases with age, but strokes can and do occur at any age. So back when we were in the thick of COVID, so in the late 2020 through about the start of 2022, we were seeing a lot of younger patients coming in with strokes. Now, was that related to COVID? Possibly, especially when you had a healthy person who had no other risk factors, and 2 weeks ago they had COVID and now they had a stroke. Could we say that it was related to that? Probably, but again, more research is being done every day to look at the effects of COVID on our hearts and our heads and just our overall bodies. So unfortunately for you providers who are on, Ryan and I see this every day. There is a drug epidemic in our state in North Dakota, I'm sure in Minnesota as well. In our nation, we have a drug issue. And so we're seeing patients probably once a week coming in with drug-related strokes. Ryan's going to talk more later about smoking and vaping especially, and how we're seeing an increased number of heart attacks because of that. So 50% of the US population, so most of us on this call probably have high blood pressure, okay? It's just how it is, okay? But the biggest thing to remember is if you have high blood pressure, we need to be managing it, okay? Managing those risk factors. The other big risk factor that people can have that puts them at a high risk for stroke is something called AFib, or atrial fibrillation. This can actually raise a person's risk for having a stroke up to 5 times. So for those of you out there in the community, AFib is when we have an irregular heart rhythm. So normally our heart should go lub-dub, lub-dub, lub-dub. When somebody has AFib, it's almost like a butterfly wing, okay? There's an irregular rhythm to the heart. And when we have an irregular heart rhythm, that can cause our hearts to break off tiny little clots. And those clots travel up to the brain, causing a stroke. Smoking, this is a big one. I haven't added vaping on here yet, but I'm sure I will in the future. But smoking increases a patient's risk 2 to 4 times higher than non-smokers. Smoking just wreaks havoc on our arteries, in our hearts, and our brains. And so it puts a patient at a very high risk for a stroke. And then the other big thing to remember is that a family history of a stroke is a big thing. So especially when it's mom, dad, brother, sister, or grandma or grandpa, if you've had a stroke in any one of those relatives, you are now at a higher risk for a stroke. Any questions so far? All right, so really quickly, I want to just touch on the different types of stroke. So these are the 3 types of strokes that we see at Ascension, Fargo. When you think of the word ischemic, you should think of lack of oxygen and blood flow, okay? When we have lack of oxygen and blood flow, that causes tissue injury or ischemia. If we can't fix that ischemia, it's going to lead to something called infarction, which is a stroke, okay? So there are 2 types of ischemic strokes. So the first type is something called a thrombotic stroke. Thrombotic meaning that the clot actually happens in the brain over time. So in this picture, you can see, here's my artery, and over time, plaque has built up on the walls of these arteries, causing the diameter of my arteries to get smaller, okay? Instead of being nice and open like this, it's now smaller. And what can happen is little particles of blood can join where this atherosclerosis has occurred, and eventually a clot forms. Okay, now this clot is blocking oxygen and blood flow. Not good, okay? The other type of ischemic stroke that we see, and this is the one we commonly see at Essentia, is something called an embolic stroke. What an embolic stroke is, or what an embolus is a piece of fat or a blood clot that breaks off from somewhere else in the body and it travels up. Okay. So maybe somebody just had hip replacement surgery, or maybe they just had heart replacement surgery with Ryan's team. Okay. What can happen is blood can pool in an area, and now a clot forms, and that clot breaks off, travels up the bloodstream, and lodges itself in the artery in my brain. Okay, so as you can see in this picture, this clot is blocking oxygen and blood flow. So again, we see this a lot with our AFib patients and a patient who's recently had surgery. Why embolic strokes are a little bit worse, in my opinion, from thrombotics is it happens like that. The blood clot travels up and it, boom, lodges in the artery and causes problems, okay? But for you out there in the community, and also the providers who are on, there's something we can do for you. So if you start having signs and symptoms of a stroke, we need to get you to the hospital quickly, because with this clot, there's a couple things that we can do. If we can get you to the hospital quickly, within 4.5 hours of your last known well, we can actually give you a medication called a clot buster. Okay, and what this clot buster is going to do is bust up this clot. Okay, but again, it's a time-sensitive medication. We only can give this up to 4.5 hours of last known well. And of course, there's certain criteria that patients have to meet in order to receive that as well. Okay. Why clot busters? Why do we give something called tenecteplase or alteplase? Because this is the reason why. So when someone is having a stroke, we have damage to our brain tissue. We need to restore that blood flow and decrease the amount of damage. So that's what tenecteplase does. So within 10 minutes of somebody having a stroke, you can see the red is bad and the green is good. So again, every minute and every hour that we're going out from our last known well, or every minute that that clot is causing problems, you can see how much damage is occurring to the brain. Okay, at an hour out, 3 hours out, and at 6 hours out. That's why if we can get you to the hospital quickly and get you that clot busting medication, we can stop this stroke from getting worse. So that's the whole point of those clot busting medications, is to limit the size of the stroke and restore blood flow. Any questions on that? Okay. Now let's say somebody presents with symptoms like the gentleman at the very beginning. That gentleman at the very beginning who was getting ready to have dinner with his family, and boom, he had multiple symptoms. Arm weakness, facial droop, slurred speech, vision issues. He was having what we call a large vessel occlusion stroke. So he was having a very significant stroke. And what I mean by that is when somebody has multiple neurodeficits that are really heavy all at once, we think that they have a clot in one of these big arteries in our brain. So in our brain, we have vessels called large vessels, okay? These large vessels supply huge amounts of oxygen and blood flow to our tissue. So if you can see in this picture, there is a large vessel called an MCA, okay? This is called our middle cerebral artery, okay? As you can see, if we have a clot or we're having a stroke in that area of the brain, if we can't get that taken care of, this is how much brain tissue is potentially going to be lost. Okay, another big vessel that we are concerned about with strokes is something called the ACA. So this is our anterior cerebral arteries. This is like our mohawk artery, okay? This one causes some tissue damage, but why our ACAs are so bad is because we have a motor and a sensory strip along each side of this, okay? These people can wind up with significant motor and sensory deficits, okay? But again, there's hope, okay? Somebody like the gentleman at the beginning of that video having sudden severe neurological deficits. If we can get these people in to the hospital, they can actually do some advanced imaging called a CT and a CTA. What the CTA is going to show is how much damage is that stroke already causing. If I can get in and get this little clot out, you see this clot? Here's that big vessel, that MCA. If I can get in and get that clot removed, I can hopefully get some of this brain tissue reperfused or reoxygenated, okay? So this is exactly what our team does at Essentia. We've got 3 interventional neurologists who actually do a procedure where they take a catheter device, they make an incision in the patient's groin and go up into the patient's brain to take that clot out. So this is inside of the artery. And as you can see inside the artery, here's my clot. We've now taken this device and are going to capture the clot. So that's the whole point of this procedure, is to capture that clot. Once we capture that clot, look at what happens. So this is an actual case that we had at Essentia. So as you can see in this first picture, okay, there's nice blood flow down the middle of the brain. And then here's that big artery, that MCA. And if you look, all of a sudden the blood flow just stops, and it stops abruptly. Why? Because of this thing right here. This is a big old blood clot, and that does not belong in our arteries in our brain, okay? So this blood clot was stopping oxygen and blood flow to my brain, causing that person to have a stroke. Once we took that clot out, look at what happened. Do we like this a little better? Absolutely. Look at how much blood flow or reperfusion we were able to get, okay? So somebody having an ischemic stroke. So just to review, somebody having an ischemic stroke, a clot lodged in one of our arteries in our brain, we need to get them to the hospital quickly and get that clot out of there by either busting it up with a medication or going up and taking that clot out. Both of these things are time sensitive. Remember from the beginning, time is brain. So we need to get in and get this alteplase, or excuse me, this medication given, or we need to go up and get that clot out and reperfuse our brain. Okay, so that's ischemic strokes. That's the most common types of strokes that we see out there, okay? All right, so now we're going to go to the opposite end of the spectrum and just talk very briefly on hemorrhagic strokes. So hemorrhagic meaning blood. So there are 2 types of hemorrhagic strokes, ICHs and subarachnoids. So here's our brain. If you guys didn't know, your brain is very vascular, okay? Again, our brain needs oxygen and blood flow. But where does that oxygen and, where does that blood flow need to stay? Inside of our arteries and vessels, okay? What happens with the hemorrhagic stroke is these arteries and vessels can actually break. And when that happens, we now have blood leaking onto our brain tissue, and that's not good, okay? Blood is actually toxic to our brains. Toxic meaning that it does not like it, so our brains are going to start to swell. So in this picture, you can see we have these larger vessels. Where's my mouse? We have these larger vessels, and then we have these tiny, smaller vessels. These small vessels are highly susceptible to a condition called high blood pressure, hypertension. Okay, so I like to use the analogy of a tire on a car. So let's say after this horribly long winter we had and all the bad roads that we've had to be dealing with, you get a new set of tires on your car this summer. And now you get these tires on, and for the next 10 years, you're driving on these tires. So as you're driving on these tires, what are you doing? You're wearing them down, right? Until 10 years down the line, you hit a nail and boom, your tire explodes. It's damaged. There's no fixing it. That's the same thing that happens with these arteries in my brain. So these tiny little arteries called small vessels can only take so much wear and tear over the years. So high blood pressure, smoking, uncontrolled diabetes, unfortunately drug use, okay? These little vessels can only take so much wear and tear till eventually a person has a hypertensive episode and boom, they blow. We now have blood leaking onto our brain tissue. And again, not a good situation. Okay, so with these patients, what you guys need to know, what kind of symptoms are these patients going to have? So these patients are going to have symptoms similar to that of an ischemic stroke. So the sudden weakness, slurred speech, facial droop, but these patients are also going to complain of a severe headache, nausea and vomiting, maybe some vision issues. But the difference with these patients is they are going to have a super high blood pressure. And when I say high, I mean 240s over 120s or worse. Okay. And why the blood pressure is so high is because I'm actively bleeding in my brain. And so my heart recognizes that and tries to push more blood up there, causing my blood pressure to go up. And that's the last thing we want to happen. We do not want more blood being pushed up to the brain where it's actively bleeding. Okay. The other type of hemorrhagic stroke we see is something called a subarachnoid hemorrhage. And the majority of these are due to something called a cerebral artery aneurysm. And maybe some of you know someone who has had an aneurysm rupture. These are not a good situation, okay? So if you look at this picture, this thing right here is an aneurysm in our brain, okay? This looks like what? A balloon, right? So if you think about a balloon, that's exactly what an aneurysm looks like. An aneurysm is a weakened balloon area on the artery wall at risk for rupturing. So now that we're finally getting into the nice summer weather, maybe you'll have kids or grandkids out playing in the yard, and maybe they'll have a water balloon fight. So think about you're blowing up or you're putting water into a balloon. Okay, what you're doing to the walls of those balloons is stretching it and stretching it and stretching it. If you're not paying attention, that balloon is going to rupture. The same thing happens with when somebody has an aneurysm in their brain. So wear and tear over the years from high blood pressure, alcohol abuse, drug abuse, smoking is going to weaken the walls of these aneurysms till eventually it can't take it anymore and it pops or ruptures. Why these types of strokes are so bad is because of where they happen in our brain. The subarachnoid space is the space in between our brain tissue and our skull, okay? Once we have blood pouring onto our brain tissue, our brains are going to start to swell. We do not have a lot of room in our heads to swell before we hit our skull, and then we're not in good shape, okay? However, for you guys out there, what do you need to know? How would I know if somebody's having one of these? There's actually some symptoms that are classic to this type of stroke. One of them is called the thunderclap headache or worst headache of my life. And we've actually had patients who come in and they are complaining of a sudden, severe, worst headache of my life. Or they're coming in and they're saying, oh my gosh, I feel like something just blew up in my head, like a clap of thunder. Okay, so think about a thunderstorm during the summer. We have that strike of lightning and then boom, that big clap of thunder. That's what people actually describe they feel in their heads, is something blew up, okay? If you ever come across somebody that's saying, oh my gosh, I'm having the worst headache of my life, I'm nauseated, my vision's not very good, we need to get these patients into the hospital ASAP, okay? Because it's possible that they have an aneurysm that's ruptured, okay? As you can see, these aneurysm ruptures are not a good situation. Not a lot of people live through these, but there is hope, okay? Again, if we can get these patients to us quickly, we can help them. We have a team of wonderful providers and nurses that can help these patients, whether it's medical intervention, surgical intervention, or endovascular intervention, including a procedure where if you have so much blood and pressure in your brain, we have a neurosurgeon that can actually go and take a portion of your skull off to help relieve that pressure. Now, that may sound just absolutely horrible to you, but that's what we need to do to relieve that pressure. And we've had patients who do pretty well after a few months after this procedure. But again, we've got to get these patients to us quickly. Okay. My last type of stroke before we look at the warning signs of a stroke is a TIA. And maybe some of you know somebody who's had this, or maybe one of you has had this. So TIAs we now call warning strokes. We used to call them mini strokes, but we now call them warning strokes, and for good reason, okay? So let's say somebody it's card night. So let's say Bob, I'm just gonna use Bob as an example. Bob's over playing cards with his buddies, and all of a sudden, Bob develops weakness in his hand. Maybe he's having difficulty with his speech. Maybe he's got a little bit of a facial droop. His friends recognize, uh-oh, Bob's not doing very good here, and rush Bob into the hospital. But by the time Bob gets to the hospital, his symptoms are gone. He has no problems with weakness. His face looks better. He's talking just fine. Bob had something called a TIA. So what this TIA is, it's all due to this thing right here. This is a clot. This clot was blocking oxygen and blood flow to Bob's brain. Bob's body recognized this and said, uh-oh, I got to take care of this. And it was able to take care of it on its own. We love our TIA patients, and these are the patients who are like, oh, I'm fine, I don't need to come in. No, no, no. If you're ever having temporary symptoms, you need to still come to the hospital, because there is a reason why you're throwing a clot. Our bodies are not designed to throw clots or handle clots. So if you're having sudden neurological problems that suddenly resolve, we still need to get you to the hospital, because we need to figure out what's causing these clots, okay? Maybe you have undiagnosed AFib. Maybe you have a blood clotting disorder that you didn't know about. Lately, we've been seeing a lot of young people coming in with something called a PFO, where they have a tiny little hole in their heart that they've maybe had since birth. And now what's happened is a clot has broke off and traveled through that hole up to the brain. Okay, if we can figure out why you're having these clots, we can hopefully prevent you from having a full-blown stroke. And that's why, again, TIAs are called warning strokes. Okay. So enough background, okay? The biggest thing I want you guys to take home today is, how do we recognize the signs and symptoms of a stroke? Now, whether you're like me and Ryan, we're nurses, we're educators, we work in the hospital, whether you're a doctor or whether you're just somebody out in the community, we actually even teach this to our younger people. We've actually been out to some elementary schools and high schools and are teaching people about BEFAST. So I don't know if you can see my shirt. I've got BEFAST on today. And this is how we recognize the signs and symptoms of a stroke. BEFAST. And the biggest thing I want you guys to remember is, when looking at this, it's sudden. S and S, sudden stroke. Okay, 1 minute the person's fine, they're at their normal, and now all of a sudden something's wrong. Something's abnormal, something's not their normal. Okay, and as you will see, under each one of these, sudden, 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 okay? Sudden change. So let's look at these. B stands for balance. So a sudden loss in balance and coordination. So maybe I have my can of pop here, and all of a sudden I can't bring the pop up to my mouth. My coordination is suddenly gone. Or maybe all of a sudden I'm just really dizzy and I'm walking along and I just can't get my balance, okay? Sudden loss of balance and coordination. That stands for B, balance. E is for eyes. This is a big one. We have a lot of people who come in and they're complaining of vision issues. So all of a sudden, maybe their vision is really blurry, or like when you wake up right away in the morning and you rub your eyes and they're kind of like just waking up, but that's happening during the day, okay? Or people can develop something called a visual field cut, where all of a sudden their one eye is just black. They cannot see anything out of their one eye. That's not a good situation. So sudden vision changes, get in, okay? E stands for eyes. F is for face. So this is one that you are maybe going to see in someone. So maybe you're having like I said, maybe you're doing cards one night and all of a sudden you look across the table and you notice your one friend has got, their face looks uneven and they're drooping here in their lip, okay? Facial droop. The biggest thing to remember with facial droop is it tends to happen right here in our lip, but it can also happen here kind of in our nasolabial fold or up here in our eye, okay? Sometimes the whole face can droop, but most of the time with strokes, it's just gonna happen here in their lip, okay, or their mouth. Only on one side. That's the other thing with stroke, is if you have sudden problems on both sides, it's probably not a stroke. If it's happening on just one side of your body, then we're concerned, okay? This is another big one, arm weakness, okay? So let's say I'm talking on the phone and all of a sudden I drop my phone and my arm goes down like this, okay? Or maybe I'm trying to grab onto something and my hand or my arm just isn't working, okay? Sudden weakness on one side, okay? That's not a good situation. We can also have weakness in our leg, but we tend to see it in our arm first, okay? So sudden arm weakness. The other thing I want to mention with our upper extremity or our arms is sometimes people will actually get numbness and tingling that all of a sudden happens. So one of the gentlemen we actually had, this was probably about a year ago, he was sitting at home watching TV when all of a sudden he noticed numbness and tingling in his hands and his arm. And he thought, well, that's weird. So of course he goes like this, just shakes it off. But it didn't go away. Okay. And then the numbness and tingling got worse and worse and worse, kept going up his arm to the point where he's like, that's not normal. Something is not right. So he went into the hospital, and sure enough, that was his only symptom he had, was sudden numbness and tingling on one side. And sure enough, he had a very small stroke. So good thing he got into the hospital. Okay. Speech. S stands for speech. So this is a big one. And when we talk about speech, a lot of times people think, oh, it's just that funny sounding speech, that okay. A lot of times people think, well, they have to sound like that in order to have a stroke. No. Speech encompasses a lot of things. So yes, it is that slurred, garbled speech, but also maybe I'm talking to Ryan and all of a sudden Ryan asks me a question and I'm just staring at Ryan like this. And Ryan says, Molly, did you hear me? Molly, what do you think? And I'm just looking like this at him. And I have no understanding of what Ryan is telling me. So I cannot understand his speech, okay? So that's something called receptive aphasia that people can get. Or maybe Ryan and I are having a conversation and now it's my turn to say something and all of a sudden I'm like, I think you are right, okay? I'm having a hard time getting my words out. My words are slowed. That's not a good situation either. So slurred speech, difficulty understanding words, or difficulty getting my words out. That all encompasses speech. Okay, that's a big one. And then of course, T. T stands for time. Like we talked about earlier, every minute our brain is without oxygen is not good. 2 million brain cells a minute die when we aren't getting oxygen and blood flow to our brain. Okay, so with this is not a checklist. Okay, a lot of times people think, well, I'm only having some vision issues and maybe a little bit of weakness in my arm, but I'm fine. No, if you are only having one of these changes and it's happening suddenly, you need to get in. I will tell you, we had a gentleman probably about 4 months ago. He was at Costco with his wife, and all of a sudden he was just steering his cart all over. His wife said it looked like he was a drunken sailor. All of a sudden, his balance and coordination was not normal, was suddenly gone. And so she brought him to the hospital, and sure enough, he had a stroke in the back of his brain. But the only symptoms he had was balance and coordination. And his wife recognized, this isn't normal. This isn't his normal. I need to bring him in. And good thing she did, because we were able to get him treatments. So that's the biggest thing. You are only having one of these symptoms and it's happening suddenly. Please, please, please get in. Okay. So now to finish up, we've talked about the different types of strokes. We've talked about how are the treatment for strokes. We've talked about how you recognize the signs and symptoms of a stroke, but now what can you all do to help decrease your risk for having a stroke, okay? So every single one of us out there, me, Ryan, and everybody out there, we're all human. So we all have risk factors. You are born, you have a risk factor, okay? And you all know that there are different types of risk factors. So there are those that we can control and those that we can't control, okay? As we get older, what happens to our arteries? They tend to get smaller, okay? So when we're nice and young, our arteries, if you guys can see my hands, our arteries are nice and open like this, okay? Blood and oxygen can get through there pretty easily, okay? But as we get older, atherosclerosis or plaque starts to build up on the walls of our arteries, causing them to get smaller, the diameter to get smaller. So now oxygen and blood flow can't get through there as well as it used to. As we get older, our arteries tend to get a little bit stiffer as well, okay? Just part of, as we get older, it happens, okay? So as we get older, after the age of 55, your stroke risk increases, okay? African Americans, geneticists have actually identified a gene that African Americans have that put them at a higher risk for stroke than any other racial group, okay? We can't change our race. Gender, ladies, sorry, all the ladies out there, we're at a higher risk for stroke than men. And it's not because we're under more stress because of dealing with men. That's a common response I tend to get when I do these presentations. No, sorry. Actually, women are at a higher risk for stroke than men because of two things. Hormones, okay? Throughout our lives, women deal with lots of hormonal changes. None more, though, than after menopause. So after menopause, there's a huge shift in our hormones, which causes some changes in the viscosity or how thick or thin our blood is, and it can put us at a higher risk for stroke. Women, we also live longer than men. Our life expectancy is about 5 years longer than men. Yay. But again, as you can see, it puts us at a higher risk for stroke as we get older, okay? We talked about family history already, but I want to just mention it again, especially in relation to that subarachnoid hemorrhage. So remember when I was talking about that big balloon that can bust in our brain? If you have had any family member who has had or has passed away from an aneurysm rupture, you need to make sure your doctor is aware of that because you are now at a very high risk for that happening, okay? And then, of course, personal history. Once you've had a TIA or a stroke, you're at risk for having another one. Okay, but again, nothing we can do about those. Those are called uncontrollable risk factors. But look at the amount of risk factors we can do something about. The biggest one on this list, Ryan's going to talk about it too, is this one right here, high blood pressure. High blood pressure, uncontrolled high blood pressure is the #1 risk factor for every single type of stroke that we talked about today. Ischemic, hemorrhagic, TIA. Okay, so AFib, we kind of already talked about this. So AFib is that irregular heart rhythm or heartbeat, okay? So let's say now that it's nice out, you're out working in the garden or you're working in the garage doing something, and all of a sudden you feel maybe like your heart is just not doing its regular beating, okay? You just feel like something's not right with your heart. You need to bring that up to your doctor, and they can do a test called an EKG to see if your heart rhythm is normal, okay? The other thing I want to mention with AFib is that if any of you have been diagnosed with AFib, you're most likely on a medication. Never, ever, 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 ever stop that medication abruptly, okay? We have had patients who take a medication for AFib and now all of a sudden they stop it because they just don't want to take it anymore. 3 days later, they come into us with a stroke. Never, ever stop your heart meds, especially meds for AFib, abruptly, okay? Carotid stenosis. So like we talked about, our hearts and our heads are connected. Oxygen and blood flow comes from our hearts up through these two big carotid arteries in our neck and into our blood, our brain, excuse me. So somebody out there maybe has heard of something called carotid artery stenosis. And that's when plaque starts to build up on the walls of these arteries in my neck. And now oxygen and blood flow cannot get up into my brain as well as it used to. So people who have uncontrolled diabetes, high cholesterol, smoking can actually cause this plaque to worsen. And now eventually this blood cannot get up into my brain, and it's going to put me at a very high risk for a stroke. So if you have those risk factors, you might want to talk to your doctor about getting a carotid ultrasound. And a carotid ultrasound is a test that they do where they just take a wand and wave it over your carotid arteries to see if you have any stenosis in your vessels that is going to cause decreased oxygen and blood flow. Okay. I wish I had 10 more minutes to talk to you guys about blood pressure alone, but I don't. Please, please, please know your blood pressure levels. Take your medication as directed. High blood pressure wreaks havoc on our arteries, whether it's arteries in our hearts or arteries in our brain, okay? If you look at this number right here, when I was in nursing school, so I graduated in 2008, pre-hypertension was considered 140/90. You are now considered hypertensive if you have a blood pressure greater than 140/90. So what the American Heart Association has done over the last few years, and the American Stroke Association, is they know how bad high blood pressure is. So they're tightening their levels because they're trying to help people get better control of their blood pressure, okay? So if you don't have a blood pressure monitor at home, pick one up, keep track of your blood pressure, okay? Take it a couple times a day. Take your medication as directed. But let's say you've been on a blood pressure medication for 10 years and now nothing else in your life has changed. You haven't gained weight, your diet is the same, and your levels are doing this. Your levels are starting to climb every day and there's no other changes happening. You need to talk to your doctor about maybe switching up that medication, okay? High cholesterol, this is another big risk factor for a stroke and heart attack. So hopefully every year when you guys go to the doctor, your doctor is drawing something called a lipid panel. And a lipid panel is going to check your total cholesterol. It's going to check your HDL and also your ADL. Total cholesterol means how much fat is in my blood. Okay, we want that cholesterol level to be less than 200. Okay, then we have two things called HDL and LDL, our good and bad cholesterol. Our good cholesterol should be around 50 and our LDL should be less than 100. So let's say you go to the doctor and these levels are just a little bit off, not horrible, but just a little bit off. Your doctor is going to recommend you eating healthier, maybe losing some weight and being more active, okay? But over time, if your levels are not where they need to be, they may need to put you on a medication. And what that medication is going to do is keep that amount of fat in our bloods low, okay? Type 1 and type 2 diabetes, the one thing I just want to say with this, know your levels, try and keep your blood sugar in that nice normal range, okay? Those spurts of really high blood sugar are not good for our vessels. Okay, smoking and alcohol use. I don't want to beat a dead horse. If you know someone who smokes, maybe you have a child or a grandchild that smokes or vapes, try and get them to stop. I can't tell you how bad smoking and vaping is to our arteries. And it puts these people at such a high risk for a stroke, okay? You can drink, you can have a beer or a glass of wine every once in a while. It's the people that are chronically drinking every day. It's wearing down the walls of those arteries, putting us at a higher risk for stroke. And now that it's finally nice out, we can be outside, we can be more active, okay? Every little thing that we do that get our bodies moving is going to help, okay? So exercise, and even just finding something that you enjoy doing outside, gardening, maybe working on your car in the garage. If you have grandkids, taking them for a walk to the park. Every little bit of movement that you're doing is going to help, okay? And then, of course, last but not least, everybody's least favorite thing to talk about, diets. Okay. You know what? Everything in moderation. If you like going to the movies and you want some buttered popcorn, that's fine. If you like having sweets every once in a while, that's fine. But you really need to watch what's in your food. Okay. When we talk about risks for stroke and heart attack, we look at salt, fat, cholesterol. Okay. Everything in moderation, and our nice food balance here, as in the plate, we need lots of protein, whole grains, fruits, vegetables, and dairy. Okay. Any questions? Oh, I did pretty good. 1101.
Thank you, Molly. That was fantastic. Anybody have any questions? I don't see any in the chat. Yeah, a lot of great information.
Thank you.
Mhm.
All right, I'm going to stop sharing and turn it over to my colleague, Ryan. Oh, wait, maybe. There we go. Thank you guys all for your time. And now to Ryan, he will introduce himself. Yay, Ryan.
Good morning, everybody. Sorry, I spoke a little bit in the beginning, but that's okay. My name is Ryan. I've been a nurse for 22 years, and I've done emergency department nursing, critical care, education, and I've worked in the cath lab, so that I go and help fix hearts for about the last 6-7 years. So I'm here today to discuss and talk about heart health. So very similar format. We'll go through the PowerPoint, and at the end we can have a question and answer section. So, or you can just throw them in the chat and I can address them as we go. So what we'll do is we'll take another minute or so if you guys need to run, get something quick or run to the bathroom quick. I'll take a minute or two here before I start. So we have a little minute of a break here. So come back in a minute. Okay, it's been about a minute or two here, so I'll get started. Let me share my screen. And let me know when you guys can see it.
Looks good.
Perfect. All right, I'm going to try to pull up the, I guess I can't pull up the screen with questions, so just shout them out at me if you have questions. Again, my name is Ryan, and I'm the Chest Pain Center and STEMI Program Manager here at Essentia. So again, we're going to be talking about heart health, and a lot of what I'm going to be saying is going to be piggybacking off of what Molly was saying. So a lot of our stuff when it comes to vascular, heart and stroke, it is related. So a lot of what she said is going to actually fit in pretty well with what I'm going to be talking about as well. So what we're going to do is we're going to discuss heart disease and essentially what it does and how it affects you, because that's what we're here for. We're going to talk about symptoms of heart attack and heart issues, some risk factors, numbers. So that's kind of important is when you go and have lab tests done or blood pressure checks, what are the numbers and why does it matter and what's significant? And at the end, we'll talk about early heart attack care. So by turning on your microphones, tell me in your own definition or in your own words, what is heart disease?
When your heart is not working like it should.
Well done. Yeah, that's essentially what it means is basically it's just a broad term for many diseases of the heart. And when we mean the heart, we also mean the blood vessels, because that's actually what's feeding oxygen and feeding nutrients to our muscle. You may have heard other terms for heart disease. You may have heard coronary artery disease or just artery disease. It also kind of encompasses arrhythmias or a not normal beating of your heart. There's some irregularities that can occur, and you may have also heard it as a congenital defect. So those are people that have genetic things that they're born with or things that they have had since birth. So, but the most common term or the most common thing that people have is that coronary artery disease. And most of heart disease, or like the majority of it, besides, genetic things, is the main reason or the main cause of artery disease is by an inflammatory process of some kind. So I know right away with COVID, they had talked about that when you would get the virus, it would cause this systemic inflammatory response in your body. And they had talked about that this would increase your risk for clotting and increase risk for blood issues and clotting issues. So this is a similar process, but it can occur from different reasons. So it essentially is an inflammatory process. A lot of it is either made up of fat or cholesterol between the walls of your arteries. Some of it can be calcium. Either way, the process is the same. So what happens is it gets into your tube system and it causes decreased blood flow to different areas of your heart. So what does that do? Well, it decreases blood flow, which decreases oxygen, which increases the strain and stress it puts on your heart. So all of this is related. And again, when we talk about this in the heart, this can be anywhere in your body. It's not just specific to your heart. It's in your brain, it's in your legs, it's in your arms, it's everywhere, in your carotids. So we specifically say heart disease because it's in your heart, but this is everywhere in all of your blood vessels. So essentially it just decreases that size of the tube. Think of a straw and you're drinking a drink and you pinch the straw. It's a little bit more difficult to get fluid through there, correct? So it's the same idea with blood flow. So if it's causing more strain and stress in your heart. And if it reaches a certain point, it can actually completely block any blood going through. And then that's the problem. So your body will compensate to a point. So it'll try to increase the heart rate or increase the strength of your squeeze to try to compensate to a point. It'll go to a point and then you're going to start having symptoms where you might have, chest pain or can't breathe or having some dizziness because it can't get that blood flow up to the brain and so forth. So all these are possible signs of heart disease, okay? And again, if it reaches a certain point to where your body just can't compensate or your heart can't compensate anymore, it can lead to a heart attack, which can also increase your risk for stroke as well. So just quick anatomy. When we look at the heart, those of you have ever had a 12 lead EKG where they put all these stickers on you and then they hook it up to a machine, then they push a button and it prints off this piece of paper and it's got all these squiggly lines on them that looks like just a bunch of gibberish. All that gibberish actually means something, and it's kind of fun. When you're able to understand it, it's kind of fun, and I nerd out when I look at them. So what you're looking at here on the screen is when we put those stickers on you, it's giving us an electrical picture of what's happening in your heart. So the reason we put the stickers in a certain area is because when we look at this picture of the heart, there's the three main arteries. So we have the right coronary artery, we have the left anterior descending, which goes down the front, and we have the circumflex. So when we put those stickers on and we run a 12 lead ECG, it gives us a picture of what's happening and possibly where it's happening. So it's extremely important to those that especially are having any type of heart issue to have a full 12 lead completed. That gives us a full three-dimensional picture of your heart. That's completely different than just putting, you know, 2 or 3 of them on and then you just sit at the bedside and there's like a little strip running. Those are two completely different things. So the 12 lead is going to give you that full three-dimensional picture, and that's the more important one too. So when we talk about looking inside of arteries, and Molly was kind of talking about it, where we have blockages and things in there that's not allowing blood to get through there. Again, if it's going to the brain, the same thing can happen in your heart, just a different part of the body. So when we look at anatomy, in a nice perfect world, all of us would look like inside of a straw, nice and straight, nice and smooth, and everything just flows perfectly through those areas. Well, in reality, nobody really has that. I mean, all of us have some type of artery disease, even when we're born. I mean, even if it's just minuscule, none of us are perfect. So in a nice, perfect situation, it would look like this one on the left here, where it has those 3 lines and the arrows coming through. That would be the ideal situation. Well, in reality, when we have some blockage built up from inflammation, so it could be cholesterol, it could be actually a little tear, tiny microscopic little tear in an artery that can occur. What happens is either the fat or cholesterol build up, and what happens is it takes that opening and it slowly makes it smaller and smaller and smaller. Well, the same thing can happen. There's things in your blood called platelets, and what they can do is they stick to each other to try to stop any type of bleeding. Well, those can accumulate more and more and more and more and more, and can also cause a partial blockage. So right here, this looks like it would be a artery disease through like cholesterol or something like that. So essentially what happens is you lose a lot of that area inside the artery for blood flow to get through. So here's another interesting, cool picture to where you can even see on both sides of the wall here, you have this plaque built up. This is just a bunch of grossness between the arteries, the walls. Now, if you look at this, this is not nice and smooth. This is the opposite of what we want, but this is what diseased arteries look like. And this is why we have to go in and do an angiogram on people and look and see how the blood flow is getting in to your heart. So here we have a bunch of cholesterol here. There's a little area up on top it's probably about 80% open, maybe 75%. Nice down here, but if you get into here, this is where it looks like it's about 70-80% closed. So at this point, you're going to have issues because you're not going to get a lot of blood flow through here. And of course, if you come down farther and you have a complete blockage to where, in this case, this picture shows this plaque actually tore through the wall, and it's just causing a bunch of things to happen here, and then you have a blood clot forming, and then down here there's not any blood flow. There's nothing past that spot. So this is what happens, and this is what happens or occurs during a heart attack, is you can either have decreased blood flow, or in this case it would be 100% blockage in an artery. So anything past that spot, you're not getting any blood, you're not getting any oxygen, you're not getting any nutrients. So that's when you have your symptoms of chest pain and you can't breathe and so forth. So there's a reason you're having these symptoms. There's something that's not right, okay? So here's a couple cool pictures that I was able to find. These are cross sections of arteries and what they look like. So the one on the left here, this is what a bunch of cholesterol and plaque is that's built up. So around here is where it should be, nice and smooth around the outside. However, you get about here and there's a bunch of plaque, and I always say this looks like a grilled cheese as it coming out the side of the bread, but what happens is this is the actual wall of the artery. So all this plaque built up has pushed everything down, and you only have maybe 60% of this artery that's open anymore. So you're losing a lot of this space for blood to get through. So this is diseased artery here.
And this
Now
is something they can't go in and take this out, can they, Ryan?
No, this is between the walls of the artery. This is nothing you can take out, but we can go in there and do an angioplasty where we put a balloon in there and kind of mash it open again, or put a stent in. But this is what happens when we see people in the cath lab, where we go in and they're having symptoms, and we go in and we take a look. All we see is this contrast going through here, and we notice there's a big pinched area up here. So that's when we look at, yep, you're having, problems, can't do steps. You can't do a flight of steps anymore without having difficulty breathing or shortness of breath, dizziness, and so forth. So this is a good example of what we see in the cath lab when we go and take pictures. So on the right side, this is actually a cross section of an artery, and there's a big blood clot in the middle. So what you're looking at is a bunch of platelets that got together and accumulated and stuck together, and it's preventing any more blood from getting past there. So downstream here, if this is, if we'd go back, let's say there's a blood clot right here, anything down here is going to be affected. You have blood flow to the clot, which would be here or wherever you would have it. Everything down here is going to be affected. So this can occur at the same thing here, or this can occur, but this just different pictures of what they look like. Okay. So those blockages and those things in your arteries, why do you care? How does it affect what you do? Well, very similar to your car. I have the analogy of a coat. If you put your coat on and it's 20 below zero outside, you go to zip it up, your zipper breaks, or it's not working, or the little teeth kind of got out of place. You're not able to zip that coat up. It's not going to be functioning as well as it should be, and you're going to be freezing your butt off with the wind. So how does it affect you? Well, it's not going to be working as well. Your heart just won't function and work as well. Same thing if you have a TV remote, old batteries aren't working very well, it's not going to work as well. It's the same idea as if we have, bad artery issues, or bad, a clotting disorder that can occur, or bad cholesterol. You're going to see effects of all of this with pictures of your heart, and it's going to manifest as symptoms. Okay. So again, the goal is to maintain our heart as best as we can. And unfortunately, some of that is out of our hands because we have genetics. Mom and dad love to pass us on genetics that, if they have cholesterol issues, which both of my parents had cholesterol issues, so they passed them on to me. If you have any type of clotting disorder, if you have any heart disease in your family, or any type of stroke, history, those are all high chance of being passed on to you. So all of this stuff can affect how your heart functions. So again, if your heart isn't working, it's not going to be efficient, and that's when it's going to manifest as different types of symptoms. Okay. So the interesting thing is, with stroke, a lot of times this happens quickly or acutely. This can happen, or you can have symptoms that occur quickly with heart disease or heart attacks, or it can slowly occur. So for instance, we've had people that say, yeah, looking back, I've probably had this shortness of breath or decreased activity tolerance for 3 or 4 months. Well, I used to be able to go and walk up my 2-story house, go up the steps, no problem. Over the last month or so, it's just becoming harder and harder where I have to maybe stop halfway up and, you know, I just have to stop, take 30-second break before I can do the other half of the steps. Or, you know, I used to go out and, you know, mow the lawn or shovel, and I used to be able to do things that I just can't do now. Now, some of that is age. As we get older, nothing gets better. Things just slowly progress. Or it could be, you know, you could have a vascular problem. You could have a heart disease that's causing an issue. So you don't really know until, you know, you go in and see your doctor. Maybe they can do an EKG and so forth, or a stress test. Essentially, what you're doing when you're walking up those steps is you're giving yourself a stress test. And it's funny because a lot of times in the fall and early winter, when the snow starts hitting, October, November, we have a large population of people that come in with heart attacks and chest pain and difficulty breathing, because what they're doing is they're out there shoveling snow. They're giving themselves a stress test. And unknowing to them, you know, they may have had symptoms that they just, you know, either poo-pooed and said, it's something else, or, you know, yeah, maybe I need to get checked now because I can't shovel like I did. So these are all different things that can affect you that you may not think about when it comes to heart disease. Okay. And again, just like with anything else, like I said, as we get older, things just start to wear out. They're not as efficient. So just keep your eyes and ears open and just kind of, you know, how you feel. If you have any, you know, questions about it, definitely go and see your doctor and provider, and you guys can figure and work out a plan. So can anybody tell me signs and symptoms or things that you feel when you might be having a heart attack or with heart disease? I've kind of mentioned some already. Has anybody had any symptoms or any issues that they've had previously that they'd want to share? Or if you've had a heart attack or a scare, is there anything you would like to share with how you felt?
Ryan, in the chat, one of the people said crushing pain, sense of doom.
Yep, definitely, for sure.
Anybody else? Somebody says arm pain.
Correct.
Tightness in your chest.
Yep. And we're going to talk about it here too in a minute, that there are also things that you may not even think about that actually are heart related. So everything that you said, chest pain, difficulty breathing, dizziness is another one, both arm or shoulder pain or one side or the other pain, jaw, shoulder, you know, neck pain and so forth. Those are all different signs or things that you feel or can experience, nausea, anxiety, and so forth. So those are all different things.
Somebody also said pain in the abdomen in women, question mark.
Yes. And we'll talk about that here in a minute, actually, how men and women symptoms, we'll kind of talk about that here in a second. So here's a bunch of different symptoms and signs, things that you might feel or experience. So chest pain is the most common sign that we're going to see across the board. Men and women both have, about 2/3 of us total have chest pain. However, there's about 1/3 of us that don't experience any chest pain at all. So when I talk about, or when you're out and about and you're at home or you're at Costco or wherever you are, and you experience chest pain or somebody complains of chest pain, you automatically think of something going on in the heart or the lungs. Well, that's good, right? That's something that we want to do, is we want to recognize these symptoms. We want to call 911 and so forth. But what about those that don't have chest pain? Those are the ones we really kind of have to focus on, because we don't think, if somebody's not having pain, we could have something else going on that could actually be a sign of a heart attack, but we don't think about it because we're like, if somebody just has nausea, you're like, maybe it's just something you ate, or, you know, maybe you just have an upset stomach for some reason. Well, you know, gastric pain or stomach pain or heartburn are all signs as well of heart attack. So, but it's those 1/3 of us that don't have the pain that we really need to focus on, that can have these other things. So again, we talked about this: jaw pain, shoulder, arm, back pain, shortness of breath, heartburn or abdominal pain, which you just mentioned, just nausea or throwing up and vomiting, dizziness or lightheadedness. This is more common in females. Men can experience it, but it's more common in females. So sweating, just can't sit still, you get that restlessness and anxiety. Bluish lips, hands, and feet. Those are definite things that are not normal. So, and that could be a breathing issue or it could be a heart issue. So fluttering or pounding in the heart is another one. And hopefully it doesn't get to the point where you actually have loss of consciousness. I know that some people have felt like they're going to pass out. Now, again, that could be multiple different things, but it's not normal. Okay. Again, that's something that to be aware about. If you might need to call 911, especially if you do pass out. Okay. So I'm going to pose a question to the group and put it in the chat. Do men and women present with the same symptoms of heart attack? Yes or no? Give you guys 30 seconds.
It's an astounding no.
Astounding, huh?
Yep, everybody's saying no, no, no.
Dun, dun, dun. No, they don't. I mean, they may, but a lot of times they may not. So it's not necessarily. So men and women can present completely differently. And that's the thing I want you guys to get out of this today is, you know, the majority of the time, men have the more straightforward symptoms. They're the ones that they have this crushing chest pain. They can't breathe. They look like death. They're pale. They're sweaty. They just look in distress. Okay. Now, again, there's going to be some that are not like that, but the majority of men have those straightforward, obvious symptoms. Women, on the other hand, are not always obvious. You guys can have these really subtle things and be having an MI. So that's the bad thing. And that's where we have to open our eyes, open our ears, look, listen, and just kind of see what's going on. Women have, you were just talking about that, abdominal pain or abdominal pressure more often. They have it's common for women to have mid or upper back pain or pressure. And it doesn't even have to be that strong of a feeling. It could be like a 2 or a 3 out of 10 discomfort. So it's nothing really blatantly obvious. But women, it's more common to have that abdominal and back pain. You have the dizziness, that's more common, and you have the more obvious nausea than men do. So the big thing to get out of this is women have the more subtle symptoms and they can be really, really light, and you could be having a heart attack. I actually had a patient years ago that her only symptom that she had was right elbow pain. And it was one of those to where we completely found it by accident, because if somebody complains of right elbow pain, you're going to do maybe check their movement of their arm, maybe shoot an x-ray, and that's about it. It was by complete chance that we actually found it and she was having a heart attack. But that was her only symptom. She didn't have anything, no breathing issues, no heart pain. She wasn't dizzy. She wasn't nauseated. She felt normal, but it was her right elbow. Now it's an anomaly. It's not very common. But again, you guys have these subtle, weird, different things that can cause an MI. In a class just this last week, we had one of our staff members mention that there was a lady in her 60s that had tongue pain. And they had no idea why she was having tongue pain. They did a 12 lead and she was having a heart attack. So again, not to say that women can't have the obvious, but you guys can have these different things, and just to be aware of that. Okay. So what are some risk factors? And we kind of talked about this already a little bit. High blood pressure. High blood pressure is a huge, huge, huge risk. That is probably one of the most common risk factors, or most obvious risk factors for heart disease is high blood pressure. Now, activity is in our area and part of the country. It's nice because in the wintertime we kind of hibernate a little bit, but as it's getting nice out, we're going to get moving around a little bit more. So that's good. Any type of activity is better than nothing. Even if it's just walking, walking is going to do a significant amount of getting that heart rate up and getting things working and functioning a little bit better. Weight control is a big thing. Again, what you put in your body is up to you. If you can prevent the fluctuation of weight, gain, just eating better in general. You don't have to completely quit things, but even just moderation, or just, instead of going out for dinner 4 nights a week, maybe just go out 3 nights, or just exchanging one thing for something else that's maybe a little bit healthier. That's going to be more successful than just completely changing your diet altogether. So little things will add up in the end. Other modifiable risks are cholesterol. If you guys have high cholesterol, you can, again, affect what you eat, what you put in your body. Your body needs cholesterol. Your body has cholesterol naturally, but adding extra isn't going to help. It's just going to make things worse. And that's what I actually got from my parents too, which I know that's part of genetics, but if you keep adding stuff, it's not going to help. If you're diabetic, getting active in controlling your sugar is going to be a lot better for you in the long run as well. Now, the last thing is the tobacco and vaping. And I don't know what it's like in your areas, but vaping is becoming the thing to do now, especially in like the high school ages and even college age kids. There's not as many smokers of tobacco, but what's happening is instead of tobacco, they're doing vaping instead. And what we've seen around here and what I've heard from people is a lot of people maybe used to use tobacco. Now they don't smoke anymore, but they've gone and switched to vaping, or they don't, they're totally not into tobacco at all, but they use the vape pens and so forth. Well, what we've found, or what we've been seeing is, especially in these young kids, is there's something called, what is it called? I can't remember the term. But anyways, what it does is it causes chronic lung disease. And we're seeing this in even 20-year-old kids. So we've had a few months back, we had 2 20-some-year-olds. I think one was 23 and one was 26. But they have chronic lung disease now, and it's all from vaping. They vaped like every day, basically. They didn't smoke, but they vaped. And they've created basically they've destroyed the inside of their lungs, and now they're going to be chronic lung disease patients the rest of their lives, and they're only in their 20s. So the thing is with vaping and tobacco, we've known tobacco for hundreds of years or thousands of years. We've known about tobacco, what it is and what it's done. It's been around long enough to where we've seen and done studies and looked at what happens. The problem with vaping is it's still relatively new. We only see what's happening in the short term. We don't know what's happening in the long term. These people that are vaping are actually part of an experimental group because we don't know the long-term effects yet. But what we're seeing is the short-term effects are not good. Now, another thing too is we don't know all the chemicals that are in this stuff. There's oils, there's like a vaporizer type thing. So all of the stuff you're putting in your body, you don't know what's going to happen, 20 years from now with what's happening with lung disease. So I have a son who's 11. He's in 5th grade, and he's a few months ago he came to us and said one of his friend vapes, and we're like, how do you know? He's like, well, he told me about it. And I was like, okay, well, what do you feel about it? He's like, I hate it. I don't want to be around him when he does it. And I'm like, that's great. That's fine. That's amazing. One of our cath lab nurses, his wife is a teacher in West Fargo, and they actually found a 2nd grader vaping. They found he was at recess, I believe, or something during school. He was out on the sidewalks and he was actually using a vape pen, and he was in 2nd grade. So they obviously confiscated it. And the thing is with those young kids is like, where are they getting it? So it's either mom, dad, uncle, aunt, brother, sister, and so forth. So it's pretty prevalent in schools, probably not in elementary schools, but a lot in the high schools and college age kids. And I'm sure, middle school, they're going to be experimenting and doing things like that. I think it's good just to even have a talk with your kids about it, if you have kids in that age group, and just, you know, make them aware of what it is. You can find free YouTube videos on, like I said, YouTube, and kind of goes through it and talks about it too. But vaping is a big thing that's been around probably 10 years or so, and it's becoming more and more common. So
Ryan, somebody
yes.
in the chat had mentioned something called popcorn lung. Can you?
That's what it is. That's what it was. I couldn't remember what it was called. Good
Thank
job.
you, Pete or Jen.
Good work. I couldn't remember it. But yes, that's what's happening, and it just destroys your alveoli and the that basically all of your oxygen exchange capability is destroyed. So it's a long-term problem. But again, this is only for people that have smoked maybe 6-7 years, maybe, because if they're only 23 years old, you know, so it's not anything that's even a long-term, like they haven't been smoking that long. And this is going to sound horrible, but it seems like tobacco is safer, which isn't the right answer either, you know. But it sounds like, you know, with the 30 some carcinogens in tobacco, at least we know what's going to, you know, progress and happen with them. We don't know what's going to happen with vaping. So essentially everything on that left side that's modifiable, things we can change, or things that we can affect. Okay. Now, risk factors that are non-modifiable, we cannot change our age. As we get older, you know, things like I mentioned before, they just start to wearing out and they just don't work as well as they used to. And as we get older, our family history is going to start catching up with us too. So that's what our parents and family pass on to us. So those are the non-modifiable things. So we're going to progress on here to numbers. We kind of talked about that we're going to hit some of these things. So we're going to talk about some heart numbers. 4 things specifically: blood pressure, cholesterol, blood sugar, and then BMI, or body mass index. Okay. So blood pressure is something that we need to do a better job of this. And I know there's medications for it. There's things that we can do, like being more active and so forth. I think there's a lot of people out there that don't realize what their blood pressure, normal blood pressure is. It's one of those things that you don't realize it's high until you just go randomly take it. And next thing you know, you're 150/97. And you're like, well, I don't feel any differently, or I don't, you know, nothing is different. My body's the same. I don't feel like it's that high. The problem is that's one of those things that you don't realize because it's happening at such a slow rate. Yet your body's adapted to it. You don't feel the changes until you have a stroke, you have a heart attack. So it's called the silent problem for a reason. Is this can happen. You can have blood pressure issues for a long time, and then over time, if let's say you don't get checked, you don't have an issue until you're like in your 50s and 60s, you realize you have high blood pressure, the damage is done already. So you need to get in to see your doctors like yearly, you know, at least yearly basis, so you can start controlling that blood pressure at an earlier age if you do have hypertension or prehypertension. So, you know, the 120/80 from what you've heard is still, it's adapted a little bit differently, but it's so easy to remember the 120/80 numbers. Let's just still go with that. It's still the easiest, but I think what they're doing is they've even lowered the top number to about 115. So anybody even in the 120s is considered hypertensive. But let's just remember the 120/80. It's still a good number to remember, and it's easier to remember that way. And again, with blood pressure, you know, even getting out and walking is going to help. Any type of getting your heart rate up is going to help. You can use blood pressure medications, which are great. We don't use them unless you have to, but even small doses can greatly improve your blood pressure. And again, Molly talked about salt intake. Wherever salt goes, water goes with it. So if you have a high salt diet, you're going to have a lot of water weight. It's going to increase your blood pressure. So if you can decrease some of that salt intake, it's going to decrease that water volume you have in your body. And then of course, tobacco. Tobacco causes vasoconstriction, so it takes your arteries from here, constricts it down, and that increases your blood pressure. So if you can avoid any type of tobacco or vaping. Cholesterol, again, this is what I have, so I'm pretty excited about it. I know a little bit about it. I just had my labs done a few weeks ago, and I'm on a low dose statin, which has greatly improved my numbers. But essentially what cholesterol is, it's a fat-like substance that, it does a ton of things in your body, and you have it stored in your body. And that's good because we need it to transport minerals. It's for hormone use. It's for cellular use. We need it, but to a certain point. Anything more is just adding issues and adding problems. So the normal goal for cholesterol is anything under 200. So if you have, I think my one from a week ago was like 181. So as long as I'm under that 200, I'm good. Obviously, if you can go a little bit lower, that would be great, but it's controlled really, really well with medication. And then we have the three different other types of cholesterol. So we have HDL, LDL, and triglycerides. So your HDL is your good cholesterol. So that actually kind of counteracts your LDL. So you want a higher HDL, but you want a lower LDL. That's the bad one. So a lot of times people that have a high of the bad cholesterol, a lot of times will have a little bit higher HDL. That's not always the same or always how it works, but you want a higher number of HDL, which is your good cholesterol. And then of course your triglycerides are just another group of cholesterol drugs and cholesterol in your body floating around. So yeah, so cholesterol it's needed, it's important, but too much of it is bad. We'll also talk about blood sugar. For those of you that are diabetic, probably have a good idea of what your normal numbers are, and then what ranges you have. You can adjust your insulin, or if you have an insulin pump, that's great. But again, we need sugar. It needs neurological function. We can't function without sugar. It's kind of our fuel in our body. So it's great to have a certain level, but anything more is bad. It's just stored as fat, and then it puts a lot more stress on our body and so forth. Anything under 100 or 99 or 100 is normal. Now, when we say normal, this is like a fasting blood sugar. So if you ever have it checked, and it would be better, more accurate if you had a fasting blood sugar level. But for those of you that are diabetic, it's whatever your diabetes doctor or endocrinologist would really want you guys to have. So I can't tell you if you're diabetic what your normal is, but it's whatever makes your body feel normal and good. But for those of us that are not diabetic, anything under 100 is kind of where we want. And then BMI is just a measure of basically how tall we are and how much we weigh and how big we are. And there is a calculation for it, and then you can actually go on the internet or go somewhere and find it. What your BMI is according to your height and weight. There's a calculation. But if you go to your primary care provider, they can calculate it for you, and then you guys can work out a plan. But this is also part of heart disease too. So if you have a higher BMI, you have a higher risk of heart disease and vascular disease. Okay, so if we can try to stay on the lower end of the BMI, that's kind of the ideal. Under 18-20%, something like that is kind of normal. But anytime we get to the higher end of the mid to late 20s or higher 20s is when we can start having a severe increased risk of heart disease and vascular disease. That also includes stroke too. So this last part, it's called early heart attack care, or EHAC. Well, I wanted to talk about this because this is something that it's a public awareness campaign that has been around for, I don't know, a decade or so, maybe a little bit longer. And essentially what it is we want people to be aware of patients that are potentially having a heart attack. So when you're out and about grocery shopping, when you're at Target or the gas station, and somebody is just not looking normal, or they're sitting there and they're just like, oh, I can't breathe, or they're sweating for no reason, and it's like, 40 degrees outside, it's not normal. They're like, are you okay? We want you to ask questions. We want you to intervene and say, hey, are you okay? Well, we want you to understand that this possibly could be a heart attack. So we want you guys to call 911 right away so you can get an intervention. We want you to get help on the way. That all these have beginnings, okay? So the reason it's important to recognize these symptoms and recognize what's going on is because about 85% of heart damage that occurs with a heart attack occurs within the first 2 hours of symptoms. So you're getting gas at the grocery store, you go inside and you pay, and there's a person in there just not looking too good, and he's like, yeah, I've had this just I can't catch my breath, or I'm kind of dizzy for about 10-15 minutes. Well, that clock started 10-15 minutes ago. So there's already things going on in your body that are starting to affect how things are working. We want you to call 911. We want the ambulance to get there. We want them to get him on the heart monitor. We want to get a 12-lead EKG so we can diagnose and see what's going on. If they need to go to the hospital, or if, it's some other reason. But the goal is to recognize the symptoms and call 911. And then after that, if they, it's up to the EMTs or the paramedics to get them to where they need to go. So local emergency department, or if you're, let's say you are 3 blocks away from the emergency department, jump in your car and drive them over there. We prefer you call paramedics. We want them to be there so they can diagnose sooner. However, if you're just a couple blocks away, just throw them in your car and take them to the emergency department. That's where they need to go. Okay. So the big thing is that recognition. We want you guys to be aware and recognize symptoms. Okay. So this is just a picture of kind of more common signs and symptoms of men, more common signs and symptoms for females. Again, they can always cross over, but generally speaking, men have that more, the sweating, the shortness of breath. Women have more sleep disturbances. They have the more dizziness than men do. Now, again, they can cross over, but generally speaking, women have the less obvious symptoms. Okay. So in summary, your heart is like anything else. You need to take care of it. We only have one, so we can't donate a heart. Got to take care of the one we have. The other big thing is to make sure if you do recognize any signs or symptoms of heart attack, which are, we talked about the chest pain, the difficulty breathing, the dizziness, the nausea, anxiety. We need you to do something about that information. Call 911, please. And then with that as well, just your normal care of your body and yourself, get a primary care doctor, go get this stuff checked out, because cholesterol, I didn't even know I had a cholesterol problem. I had it checked when I was about 27 or 28 years old. Just by chance, I'm like, let's just check it. And my cholesterol was 300 and something, and I had no idea. And my triglycerides were like 500, which are way too high. But I didn't feel any differently, and it was just something that I got from my parents. So I had no idea that I even had this. So at least go in, get checked, do a baseline, so if you recognize something, you can get treated and get put on medications if possible. And again, blood pressure, make sure you keep tabs on your blood pressure. And then of course, with anything, please, 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 if you're ever suspicious, call 911, have people come and talk with you, and have them come and check out your mom, dad, sister, brother, or you. So what other questions do you guys have for me regarding heart disease, heart attack, and so forth?
I'm not seeing anything in the chat right now.
And I think I did, didn't I send you a thing with a sheet of paper that has like signs and symptoms of heart disease or MI or something too, that you can send out to them with PowerPoint?
Yep, I got that. Awesome. Well, if we don't have any other questions, we can let Molly and Ryan get back to their day. But again, so much information.
I know it's a lot. I'm sorry.
No, don't be sorry. It's all really great information.
Yeah.
Really, really great information. And I'm glad we have it recorded so people can go back and reference it for sure.
Mhm.
So with that, if nobody has any other questions, I will again send out the recording and the PowerPoints probably early next week for those who registered and attended. So they will have those. And then if anyone has any other questions, you can send them my way and I can get them to Molly and Ryan if they are up their alleys and not mine. Yeah. So we can give people back 10 minutes of their day, and I hope that everyone has a good and safe, happy Memorial weekend. So
Mhm. Well, thank you so much. This was a lot of fun, and we definitely like doing these events. So if you have any other events or anything else you'd want to talk about, we definitely, up for discussion and maybe doing more.
absolutely. Yeah, I'm sure we will be in touch.
Thanks, everyone.
All right. Thank you, everybody. Have a great rest of your
Thank
weekend.
you. Bye.
Bye-bye.
Bye.